So we are the Feed Local Project, and we are here today to share our work with you and to request your support in enabling us to continue our work and expand it. So we want to start by asking you to consider a couple of questions. What does emergency food look like? Now, emergency food providers are food pantries and soup kitchens, and there are over 500 of them throughout Philadelphia, and they rely very heavily on donations to stock the food that they can provide to citizens. So what gets donated to food pantries and soup kitchens? The answer is often something like what you see here, often canned, boxed, and highly processed food that is high in sugar and sodium and low in fiber and nutrients. So the Feed Local project was developed to address this fact and to increase the nutritional quality of food that we have in our city's emergency food system. My name is Jessica Humphreys, and this is Kaylee Wirtz, and we met as AmeriCorps Vistas serving at the Greater Philadelphia Coalition Against Hunger and the Food Trust, respectively. And in our time as Vistas, we learned a lot about hunger in our country, in our state, and in our city. We know that 1 in 8 Americans is food insecure, meaning that they lack the money they need to buy the food that they need to lead active, healthy lives. Now in Pennsylvania, that number is higher, it's 1 in 6. And in Philadelphia, it's higher still, it's 1 in 4. It's also 1 in 4 children in Philadelphia is food insecure. So we know that there's a lot to be done, both on a policy and an economic level, to address food insecurity across the country, the state, and even in our city. But for the everyday Philadelphian, the emergency food system provides a very important short-term solution. In 2012, the Coalition Against Hunger surveyed over 250 food pantry users at 26 food pantries across the city, and they found that 70% of households who use food pantries in Philadelphia have at least one family member with a chronic diet-related illness, so heart disease, diabetes, high blood pressure. They also found that 100% of food pantries surveyed gave out primarily processed food. This is a troubling finding because it shows us that in our city's emergency food system, access to food does not necessarily mean access to good nutrition. So the Feed Local project has developed a 3-pronged approach to address this problem and to increase the nutritional value of food that is available to our citizens at food pantries and soup kitchens throughout the city. To start, we would like to collect extra bread and fresh produce from local bakeries, food co-ops, and small grocers and distribute that to food pantries and soup kitchens. We are already generating donations of fresh produce as well as collecting extra produce from farmers at farmers markets and distributing that to food pantries and soup kitchens. And we'd also like to collect not only fresh produce from home and community gardens throughout the city, but seedlings as well that can be donated to food pantries and soup kitchens with gardens where they can be grown into food-producing plants. Now, in the 1 year since our founding, we have come a long way toward our goal of collecting healthy food for food pantries and soup kitchens in our city. We have held 11 fresh produce food drives at 5 farmers markets throughout the city and collected over 1 ton of fresh produce, 2,185 pounds, that was distributed to 15 food pantries and soup kitchens throughout the city. These food drives have been very well received. Farmers, of course, are happy of the increase in business on these food drive days. Citizens, both receiving food in the food pantries and donating, are very appreciative of this opportunity. And we've also piloted recurring monthly food drives at the Jefferson Farmers Market in collaboration with the Jefferson Center for Urban Health. So here we trained Jefferson staff to operate the food drives. We also selected and scheduled 4 nearby food pantries to pick up the donations on a monthly basis. And with just that small initial input of logistical support, 4 successful food drives were held and over 450 pounds of fresh produce was collected for those food pantries.
Earlier this year, we put out an ask for seedlings through an online gardening forum, and we received an overwhelming response. We were able to collect 60 seedlings and distribute to 3 local food farms. We've also connected 1 local West Philly garden with 2 local food pantries, so they are able to have the local harvested food throughout the whole season. We've also connected with a local bakery that is willing to donate their excess bread weekly, but they are looking for someone that has a means of transportation to come pick it up. So these events demonstrate the feasibility and the need for the programs that we want to implement. We've developed a 3-year plan for our project. Year 1 really involves continuing the food drives that we've already been initiating, working to pilot our new programs, and establishing relationships with food businesses and food growers. Year 2 involves laying the groundwork for sustainability by building relationships between food donors and food pantries, as well as continuing to expand our other program efforts. Year 3 is working on supporting those relationships that we built up in Year 2 and taking a more hands-off approach to those projects. As we didn't previously state, we're asking for $73,500 to begin our first year. Our current needs for transportation and supplies are actually being met by a personal vehicle and supplies, so moving forward, we'd like to purchase our own. Additionally, we're estimating $43,000 for Year 2 and Year 3 because we've covered the initial cost of the van in Year 1. We'd like to thank you for your time and attention, as well as the mentorship of the Social Innovations Lab and our supporting organizations. We hope that you will consider supporting our efforts to ensure that good food means fresh food access means good nutrition here in Philadelphia.